Until quite recently, diagnostic and treatment methods primarily focused on the health of individual organs. In other words, if there was kidney disease, we would treat the kidney. If there was heart disease, we would treat the heart, and so on. But the relentless advances in science introduced us to the cell, and we realized that when scientists said, if the cell is healthy, the whole is healthy, we began to understand the molecule. We understood that the health of the molecule would ensure the health of the whole. At this point, both in terms of keeping the smallest unit, the molecule, healthy during disease processes, and in terms of preventive medicine to keep disease away from the organism, protecting the molecule has come to the forefront. Among the vital functions, the phenomenon that causes the most damage to the molecule is what we call oxidation. To put it in a more familiar term, it's what we all know as free radicals. What are free radicals? Cells undergo certain processes just like us, such as walking or running. They also have tasks like division and various metabolic functions. They have their own work, and at the end of this work there is waste produced, just like the trash left after eating or the waste that exists wherever there is life. These wastes, that is, the molecules we define as free radicals, are actually unpaired, unbound molecules that have lost an electron. We know what happens in summer houses. The iron rusts, and over time it renders the material unusable. The best example in term to visualize this is actually rusting. Over time, the cell surfaces begin to corrode in the same way, leading to organ dysfunction and metabolic disorders. We're all familiar with this. The use of antioxidants in human medicine is very valuable. But doesn't our body actually produce antioxidants? Our bodies, as well as those of cats and dogs, of course, produce antioxidants, but primarily during youth. Over time, the organism becomes unable to cope with these accumulated free radicals and rusting. So what if an animal is young? Is it necessary to give antioxidants? Again, during disease processes, there is so much degenerative activity that the accumulated rust is far beyond what the body can handle. At this point, just like in humans, the use of antioxidants in animals is extremely important. So which antioxidant? While there are dozens, maybe over 100 antioxidants, our primary choice is glutathione, which is referred to as the king of antioxidants. Because glutathione is a very powerful antioxidant, and 70% of it is produced in the liver. Normally, the liver produces this to a certain extent, but as I mentioned, during illness, periods of metabolic distress, times of stress, or seasonal changes, the glutathione produced is not enough. We as veterinarians, and of course the pet owners, we treated our patient. Our patient had diarrhea, kidney failure, or cystitis. The illness is over, and our family member has regained their health. And with this knowledge, we happily returned home. But at a level that we can't currently measure with diagnostic parameters, molecular and cellular damage actually occurred. Therefore, in order to clear this up and to provide a complete and holistic treatment, using antioxidants has become a necessity in light of current scientific knowledge. We considered it very important to introduce glutathione to veterinary cat and dog health, because in fact there was no such preparation either in Europe or in Turkey. Yet it is an indispensable part of the treatment. So can we take this glutathione orally? Most of us know this. People over 40 in particular know even better that when they go to the doctor, intravenous glutathione treatments are administered, especially in severe illnesses or in individuals who value preventive medicine. Intravenous glutathione is sometimes used. Why isn't it taken orally? Glutathione is a powerful molecule, but at the same time it's a delicate one. When taken orally, its bonds break down as soon as it reaches the stomach and it turns into water. When taken directly by mouth, it has no metabolic effect at all. That's why it's used in a liposomal form. In other words, liposomalization, which is the core drug delivery technology of our R&D laboratory. So glutathione is coated using a technology that encapsulates the molecule in a fatty frame, a protective shell. This also exists in humans, and we can provide it to animals daily through oral intake. Glutathione is truly wonderful and incredibly potent and powerful, but it is also true that since what antioxidants primarily function by is to readily donate electrons to vital cells or molecules that are critically missing electrons. When we utilize them synergistically as a cohesive team, we make them significantly even stronger. Products that combine antioxidants which work well together and enhance each other's effects are called super antioxidants. For this reason, in our cat product, we first chose to add vitamin E in addition to glutathione, specifically liposomal glutathione, because vitamin E is not only a very powerful antioxidant, but since it is effective in fatty environments, it is an excellent protector and cleanser of the cell membrane. In addition, vitamin C is also a very powerful antioxidant. But which type of vitamin C? Normally, we all know about vitamin C. When we give it to our children or use it during the flu, high doses can cause digestive issues, stomach pain, and diarrhea. If we use it at the correct dose, and its bioavailability, that is the rate at which the metabolism benefits from it, is extremely low. But when glucose is added to the vitamin C molecule, both its bioavailability increases and these digestive side effects disappear. Most of us are familiar with this as what we call ester C. It is a patented form of vitamin C. And by adding this to our cat product, we created a triple super antioxidant. For the dog product, we wanted to surprise the dogs a little and chose to give our glutathione in the form of a treat biscuit. We added one more thing for the dogs, alpha lipoic acid. We also added alpha lipoic acid, which is an antioxidant that prevents glucose accumulation, helps prevent obesity, and is anti-cancer, as the fourth member of the team. When should we give glutathione? When should we use antioxidants? First of all, unless the animal has experienced a serious trauma or illness, their own antioxidant mechanisms work exceptionally well until about 4 or 5 years of age. But after this age, antioxidants are not produced sufficiently. I have 9 cats at home. Some of them are outside. Most of my 9 beloved feline companions are quite geriatric, and the essential supplement I consistently use daily for them is liposomal glutathione. This remarkable glutathione also significantly increases vital energy production within the cellular mitochondria, thereby actively helping our cherished animals feel much more lively, vibrant, and considerably stronger in their everyday lives. And it also has a very powerful effect when it comes to cleaning up the rust that accumulates in tissues. So we used it for those over 5 years old. Aren't we going to use it for others? No. In all stressful situations, in all illnesses, even if it's a kitten, as I said, oxidation, that is rusting, will increase significantly. So in addition to treating the illness, we should regularly give glutathione during disease processes to protect our molecular health as well. Glutathione also has a very strong potential to increase cellular energy. It has another very valuable property. It is a very powerful immune support, especially when used during seasonal transitions. It helps the body build resistance against diseases.